Good morning, everyone. I'm excited to welcome you to today's presentation. Today, we'll be exploring the oocyst of Cystisospora belli in wet mount preparations. On this first slide, you can see an image of the oocyst itself. Over the course of this presentation, we'll discuss its characteristics, how to identify it under the microscope, and its clinical significance. Let's get started and dive into the fascinating world of parasitology. Let's take a closer look at the oocyst of Cystisospora belli, as seen in the modified ZN stain. This slide highlights the distinctive features of this parasite's oocyst, which are crucial for accurate identification under the microscope. The modified ZN stain is particularly useful because it helps to visualize the oocyst's structure more clearly, making it easier to differentiate from other similar organisms. Recognizing these features is essential for diagnosing infections caused by Cystisospora belli, especially in immunocompromised patients. Understanding the staining characteristics and morphology of the oocyst ties into the broader theme of accurate parasitological diagnosis, which is vital for effective treatment and management. Today, I want to focus on identifying Strongyloides stercorales larvae in a wet mount. As you can see, examining a wet mount is a crucial step in diagnosing infections caused by this parasite. When you observe the slide, look for the characteristic larvae, which are typically small, slender, and have a straight or slightly curved body. One of the most important features to note is the size and shape of these larvae. They are usually around 150 to 380 micrometers long and have a pointed tail. Recognizing these features helps distinguish Strongyloides larvae from other parasitic larvae. This slide highlights the importance of microscopy in parasitology, especially for detecting live larvae directly from stool samples. Identifying these larvae accurately is key for diagnosing strongyloidiasis and initiating appropriate treatment. So, when you're examining a wet mount, keep an eye out for these distinctive larvae. They're a vital clue in understanding and managing infections caused by Strongyloides stercorales. Today, I want to focus on the Enterobius vermicularis egg, as seen in a wet mount. This is a crucial step in diagnosing pinworm infections. When examining the wet mount, we're looking for the characteristic eggs of Enterobius vermicularis, which are small and oval-shaped. These eggs are often found on the perianal area and can be collected using a tape test, but observing them directly under a microscope in a wet mount can also provide valuable clues. The key points here are the egg's shape, size, and surface features, which help differentiate it from other parasitic eggs. Recognizing these features is essential for accurate diagnosis. Remember, identifying the eggs confirms the presence of the parasite, guiding effective treatment. Overall, this slide highlights how microscopic examination, like the wet mount, is a vital tool in parasitology. It connects directly to our broader theme of diagnosis, using simple, yet precise methods to identify infections accurately. Today, I want to draw your attention to the Trichuris trichiura egg as seen in a wet mount. This slide highlights the distinctive features that help us identify this parasite under the microscope. As you can see, the egg has a characteristic shape. It's barrel-shaped with clear bipolar plugs at each end. These plugs are key identifiers and are quite prominent in microscopic examinations. Recognizing these features is crucial because Trichuris trichiura, or whipworm, is a common intestinal parasite that can cause trichuriasis. In the context of our overall discussion on parasitic infections, understanding how to identify these eggs is fundamental for accurate diagnosis and effective treatment. So, whenever you're examining stool samples, keep an eye out for these distinctive eggs. They're a vital clue in the diagnostic process. Let's take a closer look at this image of a hookworm egg in a wet mount. As you can see, observing eggs like this under the microscope is crucial for diagnosing infections. The key points here are the characteristic features of the hookworm egg, its shape, size, and the appearance of the shell. Noticing these details helps us differentiate it from eggs of other parasites. This microscopic identification is essential because it confirms the presence of infection, guiding us toward appropriate treatment. Remember, Understanding what these eggs look like in a wet mount ties into the larger theme of accurate diagnosis in parasitology. It's a fundamental step in managing and controlling hookworm infections effectively. Now, let's take a closer look at the egg of Ascaris lumbricoides as seen under a wet mount. As you can see, the egg displays a characteristic oval shape with a thick shell, which is quite distinctive. This thick shell helps protect the developing larva inside and is a key feature used in identification. When examining it microscopically, we can observe the mammillated or rough outer surface of the shell, which further aids in diagnosis. Recognizing these features is crucial because Ascaris lumbricoides is a common intestinal parasite, and identifying its eggs accurately is essential for effective diagnosis and treatment. This slide highlights the importance of microscopic examination in parasitology and how specific morphological traits help us differentiate this parasite from others. Remember, the identification of such eggs under the microscope is fundamental in understanding and controlling parasitic infections. Today, I want to focus on observing the egg of Hymenolpes nana in a wet mount. As you can see, identifying these eggs is crucial for diagnosing Hymenolpiasis, which is a common tapeworm infection. When examining a wet mount, the key features to look for include the shape and size of the egg, as well as the presence of the embryonic stage inside. Hymenolpes nana eggs are typically oval and have a distinctive outer shell that can sometimes appear striated. Recognizing these features helps differentiate it from other parasitic eggs. Remember, the wet mount provides a quick and effective way to visualize the eggs directly from stool samples, which is essential for accurate diagnosis. Connecting this to our overall theme, understanding how to identify these eggs microscopically is fundamental in parasitology and helps guide appropriate treatment strategies. Let's talk about the significance of the hen concept here. When we see a non-bile stained egg, it often indicates the presence of certain parasites. For example, Encyclostoma or Necator, which are hookworms, typically produce non-bile stained eggs. Similarly, Hymenolpes nana, known as the dwarf tapeworm, and Enterobius vermicularis, or pinworm, also tend to produce eggs without bile stain. Additionally, Necator americanus, another type of hookworm, follows this pattern. Most other parasites, however, tend to produce eggs that are bile-stained, which helps us distinguish them during diagnosis. Recognizing whether eggs are bile-stained or not is crucial because it guides us toward identifying specific parasites. This understanding fits into the overall theme of parasite identification through stool examination, emphasizing the importance of egg morphology in diagnosis. So, in summary, non-bile stained eggs point us toward particular parasites like some hookworms, dwarf tapeworm, and pinworm, while most others will produce bile-stained eggs.